So we have two very esteemed colleagues today. Andrew Wong from Capital Integrative Health, and I understand that he's got a whole crew here. Dr. Wong and I have been pretty close to discussing all kinds of patients together and sharing protocols, and it's just such a pleasure to have him here and share his words of wisdom and sort of how they manage patients at CHI and also just CIH, sorry, and just talk to us about any of his pearls of wisdom. And of course, our own Cynthia Powell, who's the director of the Office of Student Opportunities program at GW School of Medicine. And I don't know, my life wouldn't be any comfortable without her because I wouldn't know how to handle any of our students.
Aww.
And in parallel, Cynthia has obtained mindfulness teacher certification and has been teaching meditation at School of Medicine now for a couple of years, right? 2 or 3 years.
Yes.
So yeah, and welcome you both. And as usual, we'll start with the COVID updates and any pearls of wisdom. And Andy, there are already questions, so you can take it in any format you want. We can have
I think asking the questions, we'll definitely talk. Have this be interactive, and I do have some slides if needed, but it could also be a Q&A. And thank you so much, Jeanette and Misha, and it's good to see you all here, and Cynthia. And I also want to thank our CIH team for coming on as well. Christine Gordon's here, our practice administrator, EJ, our physician assistant here, I see, and Liz Reese is here, and love for you to jump in on heart math here. I see her here, and thank you for Dr. Amina Keats as well. Naturopathic oncologist is here. I see her, but it's great to see everyone's faces, and it's great to see everyone here. And like I said, we've been friends for a while, Misha, and I basically, if I can't figure something out, I'll text Misha, and he usually gives me the answer. So thank you so much for being a mentor and a friend to me, and really appreciate that. And we're really trying to follow in GW's footsteps here. We are applying to Maryland Medicaid. We're in Maryland. And so I'm going to ask you for some advice on how to open up more integrative medicine to the underserved in Maryland as kind of time goes on. So I think you've been really leading the way here with AIM. So we can talk first about questions. I can get to the slides too, but I'd love to hear your opinion on this too, Dr. Kogan. Is Linda is asking, and happy Friday, everyone. Thank you for that comment. Is there a valid antibody test yet? I honestly don't think there is, to be honest, because for number one, people are asymptomatic, they might get COVID and they might not actually react to the B cells, might not produce antibodies, and so that might be a false negative. There's also a problem with the quantitation of the antibodies, so it might be lower than the threshold to which to produce a positive result, and so they're still trying to work on that. The other issue is that with SARS-CoV-1, which is the original SARS virus back in 2003, it was thought that the immunity is about a year. But in studies in China that have been done over the last couple months, they realized that the antibody duration might be as short as 2 to 3 months, which to me, and I'd love to hear Dr. Kogan's thoughts about this too, does that call into question the validity of a vaccine, or at least trying to figure out a vaccine that would actually cause a prolonged 1-year antibody response, which is what we would want, to talk about.
Yeah, that's exactly, I think everything you said is right on the money, pun intended. Unfortunately in clinical practice, what I'm hearing is those antibody tests are so often false negative, meaning the person would have a confirmed illness and then the antibody would be checked and the antibody will come back negative, which clearly is not exactly what we want. If we want to scale this test to a whole country, we would exactly hope to have accuracy good enough to do that. And so currently, unfortunately, there's a problem. I do understand that initial application for the waiver of FDA approval under emergency authorization use have been given to several companies. However, now FDA is going back, re-looking at this test and saying that unfortunately they lack validity, and there is a pretty significant political uproar about this from my understanding, which we're not going to discuss. So yeah, unfortunately, I don't recommend the test unless there's a very specific clinical indication. in certain instances otherwise. And it's exactly right that it appears that the length of the positive test is also quite in question. And
Yeah.
it's not even clear what the length is, but it's probably not a year as originally was discussed. So.
And thank you. And Linda was also asking about, are there safe ways to sing in choral groups? I'm sure there are people here that sing in choruses. You know, I like to sing myself, although I wouldn't say I'm a in tune. I'm probably better at playing piano, but you know, in terms of the safe ways to sing, I don't know if they're, because you can't really sing with a mask on, can you? Can someone comment on that? I would love to hear what the community has to say here about that.
Linda is
Linda,
okay, thank you.
There are groups that are singing with masks in Italy. I know I participate with a group there virtually, okay. But they've gone to outdoor, actually in a cloister situation of singing with distancing and wearing surgical masks, which you can actually breathe through and sing through. It's not ideal, but apparently it's possible.
Yeah, I mean, it makes sense to do that, because if you're in a clustered, you know, area that's an enclosed building, then that could be an area of transmission. So it probably would make sense to some degree to wear a mask at this point. Margaret was also had a good question. Stephen and Margaret, do you think it's safe to work out in a gym that has created social distancing between stations and has regular sanitary cleaning? First of all, I think gyms have millions of pieces of equipment, and I'm not sure how they're really able to, I mean, I'm more into body weights myself, so I'm a little biased, but I would say that certainly there is some risk going to a gym, but there's probably some risk in sitting at home on the couch and watching Netflix all the time too, and not moving your body. So I think if you're, you know, fine with that, I guess that's another question I would ask Margaret or Stephen too, is that, you know, are you required to wear masks in gyms, or what's kind of going on there? If they could.
I would actually say that it's probably a wise thing to do, to wear the mask in the gym.
Yeah, I think so. I think so too. I didn't know if it's required to wear a mask in the gym or not.
I don't know.
Okay. Yes, the gym does require that you wear masks if you're walking around in the gym, and if you're using free weights, or if you're on a mat and doing floor exercises. But when you're on a aerobic piece of equipment and working out there, then you can take off your mask.
So if you're there for a long time on that piece of equipment, yeah, that makes sense. Because then you're basically working out and using more oxygen, and you need to be able to breathe and not retain carbon dioxide with that mask when you're on the machine. So yeah, that definitely makes sense. Yeah, but I think going to the gym, getting exercise, getting that blood flowing, you know, getting out and seeing, you know, outside of your house, I think is a healthy thing to do, you know. And then Linda also is asking about what is important to ask about in indoor spaces about ventilation and airborne exposure. Well, we know that there's contact and droplet, which we know would spread COVID, but airborne is the next frontier, because 234 scientists just signed a letter to the WHO, and WHO, of course, just kind of imagined their recommendations for airborne exposure, that it can be potentially transmitted via airborne exposure, which is a much longer distance, as far as 10 meters, what I could tell, potentially. So I think, you know, outdoor I don't think is as high of a risk at all, but, you know, indoor you definitely have to think about how's that ventilation? Do they have air purifiers? Do they have circulation? Or do they have windows at all? You know, I think definitely all those things are important. How many people are in the room, things like that. So, you know, I would say eating in a restaurant is probably, if it's crowded, it's not, you know, especially at a bar for sure, is not probably a thing I would do right now. But I'd love to hear what other people have to say too.
Well, that's not where you can really wear the mask effectively if you're eating or drinking, can you? So
that's right. That's true. That's a good point.
There's no argument over, at least in the gym or other facilities, you can maintain the mask. Although, again, even the surgical mask or cloth mask, we know they don't protect the person as well as they protect others from you breathing.
Correct. And they haven't ever invented a mask yet with a hole in it so you can drink your beer or your food. So,
Yeah, I'm sure that's coming. I'm sure that's coming. It's
yeah, mass production.
Yeah.
Benita had a great question too. Medical offices are listed as being higher on the list of risks that I would like or prefer. How can office visits be safer for patients? I can tell you what we do at CIH. We don't have patients in the waiting room. We just escort them right to the practitioner room. We do a temperature check and O2 check. So we have a form that is filled out too at the front that's basically going to document that there's no fever, shortness of breath, or chest pain, or any of those kind of possible COVID type symptoms. But I think having, social distancing in the office is the way to go. And we do have everyone wear masks and gloves. Curious to see what you do at GW, Dr. Kogan.
Yeah, so at the Integrative Center, we've kind of followed similar to what you do. We actually removed all but one chair from the waiting room. People can't even...
A chair for meditation, hopefully.
Just with the looks of it. But yeah, we check the temperature of everybody. People immediately escorted them.
We do call patients for triage the night before and ask patients from the parking lot to call in so that there's not like a big crowd of people in the front when they walk in. So that's another thing we do as well. Curry asked, which is a great question too. I have not looked at the research on this. Blood type issue keeps coming up.
Yeah, we talked about this. We talked about this repeatedly on several times.
Okay.
Seems to be increasing evidence for that beyond sort of what's been currently published, which is there seems to be epidemiologic data. I think going to have to wait. Now, that also doesn't necessarily change what you do if you're O negative or positive like me. That doesn't mean I'm going to expose myself more. So.
Yeah, I'd be interested to see as they kind of keep on researching about the mechanism as to how that could be. Is A going to be more in a cytokine storm situation or not? I think based on Dr. D'Adamo's book, right, it's more like, if someone is there's also these, potentially eat right for your type kind of diets as well.
So
I mean, it's
on
hard.
that, sorry,
Yeah.
Misha.
Yeah, good. I was going to say let's keep that last question for after. And then, Andy, if you can take 5 minutes, I guess, at this point, roughly, and tell us if there are any slides you want to share.
Yeah, we can do that.
So I would like to introduce everyone to Cynthia Powell, who is a wonderful colleague and mind-body practitioner.
Oh.
And I am going to...
Wait, Janet, I think the idea was for Andy to show us a couple of slides before we move to the...
Okay.
I'm flexible. I can roll with that.
Andy, let's limit it to like 5 minutes.
Yep. Just give me like a ding if you could just say a manual ding or something. Can I click it? Yeah. Okay. So as we said, we don't really know. We don't know at this point. These are kind of the unknowns that we just talked about, I think, and I'm going to really focus more on the integrative health treatments that we have for COVID. Basically, COVID is thought to be an immune system dysfunction and inflammation that is causing death, not the virus itself. And that boosting the immune system is the most important thing we can do through nutrients, through vitamins, through blood sugar regulation, and through lifestyle medicine. And there's drugs, there's natural therapies, nothing has been proven yet, and trials are ongoing. This is from the Institute for Functional Medicine. People can have these slides if they want. It's a way to kind of divide things into prevention, infection, escalating inflammation, recovery, and different nutrients that might be helpful. I'm not going to actually go through this part. I was just going to share it with you if you want, different vitamins. I'm sure you've been through some of this already. But this is kind of what some of the things that we would think about here in terms of our clinic, supporting the natural killer cells, which kill off viruses, and the T helper cell 1 support, which also helps to kill off viruses.
I think that prior slide, can you go back there for a second?
This one?
I think that may be an interesting slide for our listeners.
Yeah, so, okay.
We haven't really talked much about specific support.
So astragalus, andrographis, reishi mushroom, and other mushrooms, including cordyceps, can help to support the natural killer cells, which are your patrol cells that are part of your innate immune system that are essentially going around, even if there's no stimulus in the body, no virus, to look for viruses, to look for cancer cells, to prevent viral infection and prevent cancer. So that's a really important. And then Th1 support is looking at killing off intracellular infections such as mycoplasma and viruses. And berberine from golden seal, although I heard from SMILE, which I learned about, is that golden seal tends to be more of an endangered species. So that may or may not be something we do a lot of. Skullcap is another one that could really help with Th1 support. So these are some of the things that we could use here. Just 1 minute on that. Thanks. I'm going to go to, this is a good article if you want to read that. There's the information about it from some medical doctors, naturopathic medical doctors and researchers. Foods, you probably talked about foods before, but you know, eating healthy, reducing sugar. I think a lot of the healthy proteins, mushrooms, polyphenols, fruits, vegetables, and cruciferous vegetables and foods high in fiber are going to be helpful too. So that's kind of that. I kind of want to focus a little bit on this for a couple minutes here. These are some of the practices we have in our clinic. We have IV nutrition here. We have biofeedback, including heart math, which has been, I think, really going to be great here. We are not having herbal medicine consultation yet, but we're working on that. And we kind of focus more on integrative health and functional medicine and nutrition. Here's one slide of basically heart math and how, you know, having a more appreciative type of coherence can improve immune function. So maybe we'll have time at the end to talk about that versus frustration. And that's going to impact the immune system. I have here some acupressure points that we can share this with you, with all the listeners here to support the immune system.
Right,
I especially like stomach 36. Huh?
Take another slide and then let's move on to Cynthia's part.
Cynthia, okay. Let me see if I can, is there anything else I want to say? IV, you probably talked about IVs already. Mm-hmm. Yoga would decrease inflammation essentially, and some poses that would help that. And then breath work actually reduces inflammation. So I think the main thing we want to say in this is that we can't depend on drugs and vaccines to save us from this. We have to depend on our own immune system because we just don't know. We want these things to work as well, but we also have to support ourselves with lifestyle. And that's mainly what I wanted to say. And then this is, I think, a really nice slide is that 1 minute of anger weakens the immune system for 4 to 5 hours, but 1 minute of laughter boosts the immune system for 24 hours, just as I'm sure meditation does as well, which is where I think we can conclude that. Here's our website if anyone's interested in finding out more about us. We're in Bethesda and we partner with GW, and I talk to Misha, Dr. Kogan here all the time. So here's our information, and thank you for having us on here.
All right, and then we'll come back, and if there are any questions left at the end, we'll, which I'm sure there are. So Janet, I kind of introduced Cynthia, but I think you wanted to say a few more words about her.
Cynthia Powell is the director of the Office of Student Professional Enrichment for the School of Medicine and Health Sciences here at GW, and she's also a clinical instructor.
All right.
Nice. Thank you. Good afternoon, everyone. I am delighted to be here with you. For those of you who may be new to mindfulness, and those of you who may like a refresher, mindfulness is the awareness that arises by paying attention in the present moment, on purpose, with curiosity, and without harmful judgment. And research has shown that practicing mindfulness can have several benefits, including increased empathy and compassion, improved immune functioning, increased optimism, improved sleep, greater focus and concentration, as well as reduced anxiety and stress. So the COVID-19 pandemic has been going on for a while now and has likely brought many changes, including altered daily routines, uncertainty, and social isolation. So during this time, it's very common to be experiencing really a wave of emotion, including stress, anxiety, fear, and perhaps loneliness. So therefore, I just want to take a moment to highlight the real importance on focusing on self-care strategies, including mind-body practices, and getting the care and support that we need to help us cope through this challenging time. So I'll be sharing 2 practices today, the safe place meditation and self-compassion break. In addition, I'll be sharing a rather brief exercise with the focus on identifying what we really want. And for the exercise, you may want to have a paper and pen handy to perhaps jot down a few notes. However, certainly not required. It's completely for you. And now I want to invite you to settle into a comfortable position. And in meditation, this could be sitting, standing, or lying down. Resting your hands in your lap, perhaps, or wherever it's comfortable. And you want to focus on being relaxed, yet alert. And take a moment to focus on where you feel your breath in your body. It could be in your abdomen, in your chest, in your throat, perhaps your nostrils. Bringing attention to the sensation of the breath. And by bringing awareness to the breath, this is a way to help bring us into the present moment. The mind, body, and breath are intimately connected and can influence each other. So our breathing is influenced by our thoughts, and our thoughts and physiology are influenced by our breath. And now, I invite you to close your eyes or gently lower your gaze if that feels more comfortable. And again, this first practice, safe place meditation, can be utilized at any time. However, it may be particularly helpful when experiencing an acute stress response. And as we begin, I'm going to invite you to visualize yourself going for a walk. Imagine that you go around a corner on this walk and come to the place that you love most in the world. Maybe it's a place where you've been on vacation, a place you like to sit in nature, or a place you like to go to with your family or friends. Imagine yourself in that place. And take in the smells, sights, feel of the place, just as if you were there. And we'll take a few moments to enjoy some time in this place. Notice your physical, mental, and emotional well-being in this place. And as you begin to close your time in this practice, know that you can come back to this place at any time. And now return to the path that brought you here. And as we close this practice, I invite you to return your focus to your breath, being aware of your senses. And if you haven't done so already, when you're ready, gently opening your eyes. Maybe you want to take a gentle stretch. Okay. And the second practice for today is a self-compassion break meditation. And this practice is a way to help remind ourselves to apply the 3 core components of self-compassion. That's mindfulness, common humanity, and kindness when difficulties arise in our lives. And it also harnesses the power of soothing touch, which can help us feel safe and cared for. So again, I'm going to invite you to move into a comfortable position. This could be the position you were in for the first practice, or you can move into another one. Again, it can be sitting, standing, or lying down. And you want to be relaxed yet alert. And when you're ready, allowing your eyes to close or having a gentle gaze toward the floor if that feels more comfortable. And taking a few moments to sense your breath in your body. And now I'm going to invite you to think of a situation in your life that is challenging, that is causing you stress. This could perhaps be related to health, or a relationship, or a work issue. And I encourage you to choose a challenge in the mild to moderate range. And see if you can feel the stress in your body. And if so, taking a moment to notice where and how you feel this within your body. And as you bring this discomfort into your awareness, if you wish, now adding the supportive touch that feels right for you. Perhaps this is placing one hand or 2 hands on your chest over your heart. Or maybe it's simply holding one hand and another in your lap. Taking a moment to feel the warmth of your own hand. And the first step in the self-compassion break is simply to notice whatever difficulty is here for you right now. To acknowledge that this is a moment of suffering. And mindfully allowing it to be fully here in your experience. And perhaps saying something to yourself to acknowledge this moment, like, this hurts. Or this is what stress feels like in my body. Taking a few moments to discover the words or phrases that resonate with you. The second step is shifting now to connect with your deep sense of knowing that suffering is part of life for everyone. This is in fact part of our common humanity. And maybe saying to yourself, I'm not alone. Or other people feel this way too. And noticing again your supportive touch on your heart or wherever feels right to you. Sensing the warmth and gentleness of this touch. And as we move into the third step, asking yourself, what kind of words do I need to hear right now? Some options may be, may I give myself the compassion and kindness I need? Or, may I be strong? Or, may I be patient? Or may I accept myself just as I am? Taking a moment to find whatever words are most nourishing to you. And if you cannot seem to find the right words right now, imagine that a dear friend or other loved one is struggling with the same challenge. And what would you say to them? And now see if you can offer the same message to yourself. Giving yourself the kindness that you need in this moment. And even if the words don't come easily, allow the feeling of kindness to fully be here. Sensing the self-compassion of this moment. Breathing in and breathing out, just as you are. And this practice can be used any time of day or night. It may help you remember to evoke the 3 aspects of self-compassion when you need it most. And as we bring this practice to a close, again, I invite you to return your focus to your breath or another focal point if that feels more comfortable, and gently opening your eyes.
Thank you, Cynthia, so much.
You're welcome.
Janet apologizes. She's going to stay muted because it's quite loud on her end. And on my end, there's some Spanish in background. That's my kids taking a class. So I apologize if you hear a little bit of background noise. So maybe anybody want to share how you feeling and any reflection on the practice? For you, of course, can you type this up as well? Or if anybody would like to speak, just unmute yourself and say a word or two.
The second practice, I think, was very, very good, because you kind of you get to accept or relax in the situation. So it's kind of like I meditated with the teacher that said with thoughts should come as waves. You should accept them and let them go when they come, and you meditate. And I kind of feel the same with the self-compassion, that the situation you can kind of accept it and be it in. So I love that one. Yeah.
Thank you, Jack. All right. So I guess we'll go back to questions. So I can take the first one, and then I'll hand the next one to Dr. Wong. So what about asthma and being on medications? So yeah, so the asthma, just like any other medical problems, probably increasing risk of complications. Surprisingly, blood thinners is actually used currently as a treatment, as a standard treatment for every single patient with COVID, since it turns out that very large proportion of complications occur from microclotting. So actually being on a blood thinner is probably protective, although again, we don't really have the information, but I wouldn't be worried about that specific medication, just as a brief point. So, all right, I think the next is, let's see, Linda is asking, oh, she likes to share something. So if everybody want to take a look at by the way, I don't know if everybody knows this, if you want to save the chat, on the right bottom, right next to under the chat, there is 3 dots. If you click on this and you scroll up, you should be able to save the chat at the end. And then it'll just save itself on a desktop, including all the links and everything. And since I'm on housekeeping, yes, we will be sending Dr. Wong's slides to everybody, and I guess they will also be shared somehow one way or another through the link on GW-IMH. All right, let's see what else. So take baby aspirin. There was a private question, sorry already. No, actually it's not clear. Don't take baby aspirin unless you're put on it by a physician. But if you're already taking it, don't stop it, and it's probably a good thing that you are on it, at least for time being. Although the aspirin came under fire quite heavily in the last couple of years as prophylaxis for coronary artery disease. So.
If you do take baby aspirin, I would take vitamin C 500 to 1,000 milligrams to reduce the risk of ulcers with that. That's one of the things. I feel so much better after the, I mean, I've had a pretty busy day myself, so thank you so much, Cynthia. This is really great.
You're very welcome.
Immune system is already boosted. Natural killer cells are circulating around more by doing this. Yeah, I mean, I think that going back to the indoor ventilation question, what air purification is needed to be at least risk in indoor situations to airborne COVID transmission? I mean, I think some of the ones that are more popular, like like Air Doctor or Pure, anything like that would be enough. But I don't know if I don't have any other information by specifics. Do you, Misha?
Well, I think I agree with you. I think anything that has a certified HEPA filter that has been appropriately maintained should be better than nothing, I would think. But frankly, I don't think anybody ever looked into this. I mean, my preference would be that just you would have a good air ventilation to outside, but it may not be possible. It also may not be practical, even when it is possible. So
I agree. Yeah, I agree. That's a good having a HEPA filter, and you know, it's especially because we're all indoors now more. We have to think about going outside more, really, because indoor air is 4 times as polluted as outdoor air, even if you're, you know, we're in the city here. So, you know, I think, you know, outdoor air is still going to be more, you know, better for your lungs and, you know, oxygenating that. Also mold, you know, that's another piece, you know, just in terms of mold exposure, being indoors more. Acupressure, Mary asked about acupressure. I like a couple of things that could be really synergistic with the meditation. One is called Governor Vessel 24.5, which is a third eye point. So if you point your finger, I guess, down between your eyebrows, you can kind of feel, you might have 2 fingers to get some more traction. You can really take a deep breath in and out, and it's a nice way to just kind of calm down the nervous system, stimulate your vagus nerve. And then another point is called large intestine 4, which is a point between your thumb and your pointer finger. So there's a point right here, and the space between that thumb and pointer finger, that little meaty part called the thenar eminence, and you can kind of rub that in any direction you want in a circular way. You know, I was taught up to 10 minutes, you know, it's like your acupressure basically. And that's good for headaches, good for pain, and reduce inflammation. And you can do it on the other side as well. Another point, which I might have to show my legs here. I don't know if you want to see my legs, but stomach 36 is a point. I want to try to do a little of pseudo yoga, not being a super flexible person, but you know, my knees here. So I'm going to have my tibia tuberosity right here. And so that little pointy, so you have your kneecap, patella, and then your tibial tuberosity right here. There's a little pointy part below that. So you can go a little bit to the outside of that. And there's a little divot there, about 1 or 2, I would say 2 finger breaths to the right of the right leg, or to the left of the left leg. And there's a divot there called stomach 36, which is in Chinese medicine called a chicken soup point. And it's very good for immune system. And when you take that point in acupuncture, you definitely feel a big difference in terms of just, you know, feeling better. And you can do some of this at home since you don't have access to acupuncture all the time now. You know, with acupressure, you can stimulate that point, or you can have someone help you with that. And I also like to use Qigong in addition to acupressure, because Qigong is energy medicine without the needles as well. And so I'm sure that, you know, we can either come up with some slides but, you know.
We can actually we can do the class in there, since you brought up this idea, Janet. So I'm happy to teach in a couple of weeks.
Well, I think one of the things that's really cool is we're going to do acupressure with Dr. Deirdre Osore in a few weeks.
Awesome. See,
but Misha, find somebody to do Qigong and I'll schedule it.
I'll do it myself. It's okay.
Okay, cool.
Yeah. Or I'll bring one of my good friend, James Hopes, if he wants to do it.
Great. Jack, I'm not sure what the question is. Maybe if you want to speak up about that on lithium and methyl.
I think you have to say if there are concerns with those medications.
Okay. In regards to immune system, or?
I guess COVID.
COVID?
Yeah. Jack, do you want to type it up or unmute yourself?
Yeah, it's because I'm on all those medications, and I just started on lithium and metaphenylate, which is the ADHD medication.
Yeah, I would probably, Dr. Wong and I see we're trying to figure out how to answer this. I don't have a good answer to this.
Yeah, from a functional perspective, I mean, from a short-term perspective, I don't really see a issue with that. That is a known immune system issue. I mean, I think, you know, you could get into the integrative function approach of how to balance neurotransmitters with different ways. Yeah, that's a big topic.
Yeah, cool. I'll go into it. I'll check online and stuff.
Yeah,
It's
I mean,
a big question.
It's a big, yeah. I think it's your question about immune system, like will it impact?
Yeah, compared to as if I'm strong enough to withstand stuff.
Oh, I see. Well, I think there's a lot of other things that would be making more of an impact, like the mindfulness practice that we just did today, like acupuncture, acupressure, nutrition, sleep. You know, sleep is probably one of the biggest things.
Cool.
Yeah.
Thank you for answering.
Yes, I would support the adrenals, though. I would definitely do that. We know long-term methylphenidate use will potentially suppress the HPA axis. So I would definitely do some adrenal, either ashwagandha, rhodiola, or some other herbal combination to help with the adrenals and everything. Yeah, Qigong is great. Yeah, I am definitely a beginning student. I'd love to learn from Dr. Kogan here. Have you been practicing for a while, or?
Yeah, for quite a while. I'm actually been learning with the same teacher, the James. There are a lot of local teachers that we have that are really good. Even we have one good teacher in our own GW.
Oh, good. Oh, nice.
Yeah, we have a social worker at palliative care, B. Lipson, who's been teaching Qigong and Tai Chi.
Is there an online resource that people could?
Yeah, that's what I was just trying to look up. One of the problems with the standard resources that I have not really had chance to look at them myself to sort of, you know, be comfortable. The only person that I know who transitioned to do regular online sessions is James. I'm sure others too. I just didn't have time to look it up. So I'll take that on as a homework to try to find the good classes.
Yeah, I have heard from a patient that had really good results with the Chi Center in New Mexico. The Chi Center, that's one. I think maybe it's like this. But I haven't tried it myself yet, but that seems to be interesting. And then I guess, yeah, sleep is so important. Mary was asking suggestions for those who work night shift to have good quality of sleep. I know that definitely with either hospital or other night shift work, you know, that will kind of dysregulate the day-night axis. So you know, you probably want to try to reverse that and, you know, sleep during the day. And I'm not sure how the night shift is for you, but you'd probably want to do 1 week at a time. If you're doing a night shift, 1 week a day shift, then the next week you'd have to shift that every week, and that will be better for your body. You know, I think you may, you know, melatonin may be helpful there to help you with that, just because I think that gets suppressed at night if you're working night shift. But besides that, you know, I think it's hard with night shift. I think you have to just try to sleep during the day and try to do that. Do you have any suggestions for that?
So I was typing up email to James.
No. I mean, in terms of night shift, besides if you have to work night shift, you know.
Yeah, there's no, surprisingly, I don't think there's really easy answer to this. There's no bypass of, you know, if you have to work your whole life that way, you probably can adapt to some degree, but in and out of night shifts, you just have to do it. We're all, those of us physicians on a call who had to go through residency, had to suffer through this, and it's definitely not, yeah, it's definitely not a healthy pattern. So I'm not sure how to remedy this outside of saying, get through it and normalize the circadian rhythm after. But it's a good question. Yeah,
it's a good question. Yeah, I think if you can work night shift, then you can shift some of your shifts to day shift, and if you can do that, that would probably be helpful to at least week by week. I think where I've seen it be an issue is if people are working, you know, 1 or 2 night shifts and then day shift on the same week. I would try to avoid that at least, to give your body at least a week at a time to adjust to that.
Misha, I know that Tai Chi is a type of Qigong, but would Tai Chi be good as well?
No, so the difference is Tai Chi is a very loose term. It's a very broad term. Tai Chi can be very martial. It can be very health-based. It could be all kinds of reasons for Tai Chi. Tai Chi usually implies a movement of some sort in terms of the movement in space. You know, with legs moving too. Although Qigong also can have movement component also. It's just going to be quite difficult to demonstrate Tai Chi in a class because you would have, everybody would need to have enough space. You would need to have a pretty substantial size room versus Qigong can be done usually at a very small amount of space. Plus Qigong traditionally thought to be much more health and kind of a energy-based work rather than Tai Chi, which is of course also has that component, but in a significant way, it's really a martial arts application, although again, with a core strengthening and overall, of course, there's a tremendous amount of benefit from practicing Tai Chi. But again, I would think that doing this in the format of our class is going to be way more difficult. Also because you do have to memorize some of the movements. In Qigong, it's a lot easier. The movements are much, much simpler usually. So I think let's try Qigong first.
Okay, everybody. So we need to start doing Qigong.
With that, I am promising we're going to do it soon. So we'll figure. We'll had a good teacher, and I agree. I personally know James well, and it sounds like Donna knows him too. And so we have at least a couple of people already working with him. So we'll see if he'd be interested in coming on. So, thank you, Cynthia, so much. Thank you, Dr. Wong, Andy, and everybody else.
Thank you so much.
My pleasure.
Questions, and don't overheat on the weekend. It's going to be warm here if you're here.
Everyone have a beautiful weekend.
Take care. Be well.
Bye.
Bye.
See you next
Thank you
week.
all very much.
Thank you very much.